Andito, ay, kompleto kami ngayon. Dr. James is around. Dr. Mike is around. Dr. Melanie is here. Sino pa, ma'am? Good morning. Si Dr. Bea, ma'am. Hindi pa, no? Nagle-lecture pa?
Lecture siya, ma'am, ng 10 to 11. Then si Doc Mike, 11 to 12.
Ako, salingket lang dito. Salingket. Okay. Thank you po. Ma'am, pa-remind po si Doc Bea mag-join second hour. Nagko-cope pa yung aking connectivity. Pasensya na po. Please a minute. Ayaw mo. Here. Ilang po. Yan. Okay. But ayaw niya mag-highlight. Oh no. A minute, I'm having okay, I'll just check ha. Mukhang nagkakaproblema. For a while. Okay, there you go. It's not appearing on my game. Yan.
In this section, we'll look at the pelvic cavity. We'll look first at the bones and ligaments that surround the cavity. Then, we'll look at the muscles of the pelvic walls and the pelvic floor. Then, we'll see the principal blood vessels and nerves of the region. We'll start with the bones. We've already seen the upper parts of the bony pelvis. Now, we need to look at the parts of it that lie below the pelvic brim. Let's get oriented. Here's the bony pelvis, together with the fifth lumbar vertebra. Here's the pelvic brim. We'll be looking at the pelvic cavity from 4 different viewpoints. We'll look down into it from above. We'll look at it from the side, with the opposite half of the pelvis removed. We'll look at it from behind. And we'll look at it from below. We looked at the features of the upper part of the bony pelvis in the last section. The bones that contribute to the walls of the pelvic cavity are the sacrum and the coccyx behind, and the lower parts of the hip bone in front and at the side. We're looking at the bones in the position they occupy when we're standing upright. In the upright position, the surface of the upper part of the sacrum is angled at 30 degrees to the horizontal. The tip of the coccyx points forward at about 40 degrees. So the pelvic surfaces of the sacrum and coccyx form a curve of a bit more than a quarter circle. The lower end of the sacrum is on a level with the top of the pubic symphysis. This big gap between the sacrum and the hip bone is called the sciatic notch. It's bridged by 2 major ligaments, as we'll see shortly. Now, we'll look at some details of the hip bone. This massively thick part of the hip bone is formed by the fusion of the ilium, the pubis, and the ischium. It's smooth on the inside and on the back. It's deeply indented on the outside by the socket of the hip joint, the acetabulum. This is the body of the ischium, which ends below in this impressive projection, the ischial tuberosity, which is what we sit on. This sharp prominence is the ischial spine. The large hole in the lower part of the hip bone is the obturator foramen. In the living body, it's largely closed off by the obturator membrane. This is the body of the pubis. The part of the hip bone below the obturator foramen is the ischiopubic ramus. The two ischiopubic rami, meeting in front at the pubic symphysis, form the pubic arch. When seen from the side, the ischiopubic rami slope backward and downwards toward the ischial tuberosities. There are important differences in shape between the male pelvis and the female pelvis, which is adapted to the important requirements of childbirth. The female pelvic cavity is wider from side to side and deeper from front to back than the male. In addition, the angle of the female pubic arch is broader. When seen from below, the inferior pelvic aperture of the female is wider in all directions than that of the male. Now that we've looked at the dry bones, we'll look at some major ligaments which are important in holding the sacrum and the hip bones together. The weight of the body is transmitted from the vertebral column to the hip bone at the sacroiliac joint. The sacroiliac joint is strengthened behind and in front by ligaments. The anterior sacroiliac ligament in front and the massive posterior sacroiliac ligament behind. In addition, the sacroiliac joint is strengthened by two major ligaments which pass from the sacrum to the ischium, the sacrotuberous and sacrospinous ligaments. Here's the sacrotuberous ligament. The sacrotuberous ligament arises here on the back of the sacrum. It passes laterally, downward, and slightly forward. It's inserted here on the ischial tuberosity. Now we'll add the sacrospinous ligament to the picture. Here it is. The sacrospinous ligament lies in front of the sacrotuberous ligament and medial to it. It goes from here on the edge of the sacrum to here on the ischial spine. These two ligaments divide the gap between the sacrum and the ischium into two openings, the greater sciatic foramen and the lesser sciatic foramen. Let's take a look at a complete pelvic specimen from behind and from below. The sacrotuberous ligaments behind and the ischiopubic rami in front form the boundaries of an opening beneath the pelvis that's called the inferior pelvic aperture. Seen from beneath, the opening looks like an ellipse, but it's not a flat ellipse. Because of the steep downward curve of the sacrotuberous ligaments behind and the slight downward slope of the ischiopubic rami in front, the ellipse has a marked bend in it. Here's the inferior pelvic aperture seen from above. When we look at it from up here, it's not so easy to appreciate the three-dimensional shape of the opening. Now, let's review what we've seen of the bones and ligaments that surround the pelvic cavity. Here's the hip bone, the sacrum, and the coccyx. Here's the sciatic.
Okay, everybody, please turn on your camera. We will go for a recitation. Please turn on your cameras. Okay. We will review after every video. There will be a review section. So we'll see if you can recall the structures. that were discussed by Dr. Aklan. So for this first area that is being pointed, review na lang to ng skeleton ha, ng pelvis. Okay, so ano yung area that is being pointed in this picture? Yes, Dr. Lawan?
Hello po, Doc. Good morning po. Sciatic notch po.
Very good. But which specific sciatic notch?
I think po, Doc, the greater sciatic notch po since above po.
Oh, yes, above. And ano pa in terms of size? Bakit siya greater?
Mas bigger po siya compared po sa lesser sciatic notch.
Okay, very good. So let's see who's going to answer the next question. Thank you, Doc. Okay. What is this structure? What is this dashed line? What do you call it?
Po.
Very good. Okay. Thank you. That was Dr. Judith?
Bernardo po.
Okay, Dr. Bernardo. Sige, thank you. So that's the pelvic brim according to Dr. Aklan. Dr. Judith, you raised your hand. Is there another name for that? Is there another name for that? Dr. Judith?
Pelvic inlet po.
Okay, very good. So the usual next question would be, what are the borders that form the pelvic inlet or the pelvic brim? May I ask for a volunteer? Yes, Dr. Castro?
For the posterior po, it's sacral promontory and lateral is iliopectineal line. And then the anterior po is symphysis pubis.
Symphysis pubis. Okay, very good. Sige, thank you, Doktora. Next, wait a minute. Oops, okay. Would like to name this area, this opening? Yes, Dr. Nohara, I can see you moving your lips and answering it correctly.
Obturator foramen.
Okay, very good. Meron bang structure na dumada?
Meron.
Oh, parang obturator van tawag nila. There's a specific canal that, okay, that you will appreciate later. Okay? May obturator van, vein, artery, and nerve that will pass through. Okay? Pero this one is actually covered by the obturator membrane. Tama? Merong membrane yan eh, na nakatakip. Makikita nyo rin siya mamaya. Okay? Very good, doctors. Next. Uy, ischial. Oops, ito na. Huwag yung ischium. Andar natin ng konti. Yan. Ano yan? Ano yan? Okay. Uy, ang dami nagsasalita. Okay, Dr. Navarro, thank you. Pero puro naka-mute. Sige, okay lang. Unmute lang. Huwag matakot. Okay lang. Magkamali. Hindi pa naman practical sick. Ayun naman, review nga lang eh. Okay, so, ischial spine. The ischial spine, kung papansinin nyo, is a landmark dividing what? The greater sciatic notch above and the lesser sciatic notch below. Okay? Also, the ischial spine is an attachment of a ligament, okay, which we will ask later. And sometimes there is such a thing as a pudendal nerve block na ginagamit yung spine, okay, the ischial spine as a landmark. Kasi when you do your internal examination, you palpate for that. You can actually palpate that. Okay? Sige. So let's now move on to the next. Oh, ano itong inuupuan ninyong lahat ngayon? Ha? Ischial? Okay. Silent movie. Ischial? Very good. Okay. Perfect score. Very good. Okay. So, ischial tuberosity. Walang tanong si Dr. James ngayon. Kanina, daming tanong kanina, bawat structure. Bilisan na natin, baka magtanong eh. Okay, okay. Joke lang. Body of the pubis. If that's the body, what is this now? Oh, unmute para makasagot. Unmute. Ay, baka may sumasagot pala sa chat box. Sorry. Ay, okay po. Kaya pala quiet si Doc. No problem. Ramay, may sabi po. Again?
Pubic arch po ba?
Parang hindi lang arch eh. Parang may galamay siya. They call it a ramay.
Facial ramus po.
Ischiopubic ramay. Pero meron siya ha. Try to look at letter and then identify. That's a ramay. Okay? Sige. Masarap palang tanungin to. Okay. Review nyo sa skeleton to eh. Last semester pa ha. Okay. Matanong nga ito. Joke lang. Joke pero tinotoo. Next! Ayan. Grabe kayo pag nagkamali pa kayo dito. Utang na loob, babalik tayo sa first sem lahat. Okay, what is this? Silent movie ulit. Ayos! Very good. Correct. Dr. Navarro, what is it actually?
Pubic symphysis po.
Very good. What type of joint? Ayan. Humikot na yung mata. Okay, then, inaano ko lang kayo. Sinishake ko lang kayo. Okay? Is it a fibrous symphysis? Diba?
Cartilaginous po.
Fibrous, cartilaginous? Okay, sige. Aralin natin. Sino ba yung nagturo ng skeleton and joints last semester? Sino ba nagturo last semester? Naalala niyo pa? Anyways, mamaya tanong. Sino?
Si Doc Gomez po.
Sige. Tama-tama matatanong natin later. Kung tama tayo. Okay. But suffice it to say, usually it's also called a symphysis. That's why the name is also symphysis pubis. Okay? Sige. Next. Next po. Yan. This is also important. What do you call this area? Uy. Tumalon. Balik tayo. Okay, what is this? The dashed line below?
Pubic arch po.
Okay. What is important about the pubic arch is it is one of the borders of your pelvic outlet. At the same time, ano yung mas steep or mas acute ang angle ng pubic arch compared to one which is wider ang pubic arch? Pag wider, male o female?
Female.
Pag more acute,
Male.
lalaki. Okay. Bakit niya kailangan maging wider sa babae?
For delivery.
Okay, because
Very
yes, very good. Kasi the widening of the angle will also be a reflection of the wide greater pelvic area. Tama? Yung greater pelvis, yung false pelvis. At saka yung angulation ng pelvic bone ninyo, yung girdles ninyo. Okay? So that makes the angle of the pubic arch wider. At lahat in preparation for housing the baby. Okay? And eventually expelling the baby. Okay. Pero nag-widen pa yan kapag palabas na talaga yung baby, ha? Kasi mas because of the hormones, pregnancy hormones, mas nagiging flexible yung joints eh. Okay? Mas nagiging flexible siya to allow the baby to actually be expelled. Okay? May extra word. Okay, let's see. Oops. This is good to know. Your sacroiliac ligaments, anterior and posterior. Okay? What is this now? Tingnan niyo yung attachments. Sacrum to blank. Sacrum to blank. What is this?
Sacrotuberous ligament.
Very good. Okay. Yeah, next. What is this ligament this time? What is that ligament?
Sacrospinous ligament.
sacrum and the spinous. What happened now? Ito kanina yung greater sciatic notch. Ito kanina yung lesser sciatic notch with the spinous, ischial spine. Now, the two ligaments created a defined space. Okay, the one above is now called?
Greater sciatic foramen po.
And the one below is?
Lesser sciatic foramen po.
What is important also now with these structures is alamin nyo ano yung structures that pass through the greater sciatic foramen. What structures pass through the lesser sciatic foramen? Or both? What structures pass through these two foramina? Okay? Sige. Dapat alam nyo yun. Okay? Next, let's see. Meron pa ba? O yan, greater sciatic foramen, lesser sciatic foramen. I think that's the last one. Okay, very good. Papasa na sila sa practicals, mga docs. Okay? Sige, hala. Next, the other half of this video naman is coming from UBC, University of British Columbia. To review you again, kasi mas dry yung specimen, mas makikita nyo siya, yung mga structures more clearly. And then, it will also show you the obturator canal, okay, in relation to the obturator vein, artery, and nerve. Plus, ipapakita niya sa inyo yung relation ng ligaments talaga, okay, using a model. So, let's continue watching.
Doc, wala pong sound.
Through the bony pelvis. Hello everyone and welcome back. In this video we are going to walk you through the bony pelvis, its muscles and the nerves. Let's begin with the bones. The bony pelvis is made by the right, left hip bones, the sacrum and the coccyx. In this specimen we do not have the coccyx. The right and left hip bone, however, are referred to as pelvic girdle. The bony pelvis is divided in two parts. Actually, we have two pelvises, let's say. The greater pelvis or false pelvis, top here, on the sides, as you can see, is bounded by the iliac fossa of the hip bone. And then the lesser pelvis or true pelvis, which is located down here. Between these two, we have the pelvic inlet, which is located right here. So let's go with the parts of the pelvic inlet. In the midline, we have the promontory of the sacrum. Then we have the ala, still part of sacrum. The arcuate line of the hip bone. The pecten pubis of the hip bone and iliac crest. So then of course we have the same thing on the other side. That is called the pelvic inlet. And of course we have the diameters for the pelvic inlet. On the other side, if I flip the pelvis, okay, so we have the pelvic outlet anteriorly made by the pubic arch right here. That is practically the ischial pubic ramus, one on each side. The ischial tuberosity. And then in the midline, we have the coccyx. So the posterior part of the pelvic outlet here that I can show actually on my plastic model here is made by the sacrotuberous ligament. Sacrotuberous ligament, this one and this one. So then practically this is the pelvic outlet, and as you can see, it's diamond shape. So we go with that actually later with the perineum anatomy. Okay, back to the bony pelvis. On the lateral actually wall of the true pelvis, hopefully we can see from here. So we have the greater sciatic notch of the hip bone, then we have ischial spine, this lesser sciatic notch right here, and then of course we can see the same thing on the outside. So here's greater sciatic notch, lesser sciatic notch, and ischial spine. So later we are going to actually attach the ligaments to these bony landmarks. Good to know that on the lateral wall of the lesser pelvis or true pelvis right here, we have the obturator foramen of the hip bone. And later we will see that obturator foramen is covered by the obturator membrane. Before we go with the real specimen, I want to walk you through the ligaments on the lateral pelvic wall. So as you can see from superior view, we have two ligaments there. I'm going to turn the pelvis and see the ligaments on the lateral side. Here is the sacrotuberous ligament, and this one is sacrospinous ligament. Then practically these two ligaments convert the greater sciatic notch and lesser sciatic notch of the hip bone into foramen. Here is the greater sciatic foramen and lesser sciatic foramen. And then on the other side right here is the obturator membrane that fills the obturator foramen. Okay, let's look at the ligaments in the real pelvis. Okay, so I'm going to turn the pelvis and look at on the lateral side. Here is the sacrotuberous ligament, and right here is sacrospinous ligament. Practically, as you can see, the sacrospinous ligament right there is covered by sacrotuberous ligament in the real specimen. It's totally different than the plastic one. So sacrotuberous ligament, and here is the sacrospinous ligament. So let's see if I can see the ligaments from inside. Then here it is. That is the sacrospinous ligament from inside. Okay? And then of course the obturator membrane right here. And in this real specimen, we can see the obturator canal. So beautiful obturator canal right there and here. And later we will see the obturator vein, artery, and nerve passing or actually pass through the obturator canal.
So we move on to the next video, which will deal with the pelvic muscles. Okay, I think we have 4, pero subdivided into 3 parts pa yung levator ani. So you will be studying 6 muscles, okay, in the pelvis.
Now, we'll look at the muscles of the pelvic cavity. First, we'll look at 2 muscles which form part of the wall of the pelvic cavity, piriformis and obturator internus. Then, we'll look at the complex sheet of muscles, collectively called the pelvic diaphragm, which form the floor of the pelvic cavity. We'll look at these structures first in a male specimen. Piriformis and obturator internus are both hip rotator muscles, which arise within the pelvis and pass outward through the sciatic foramina. Here's piriformis. Piriformis arises from here on the sacrum. It passes laterally and leaves the pelvis through the greater sciatic foramen. We'll see where it goes in a minute. Next, we'll add obturator internus to the picture. Obturator internus arises from the obturator membrane and from this wide area around it. Obturator internus leaves the pelvis through the lesser sciatic foramen. In doing so, it makes a 90-degree turn around the lower part of the ischium. Piriformis and obturator internus pass laterally to insert on the greater trochanter of the femur. Their actions as lateral hip rotators are shown in Volume 2 of this atlas. In this section, we're concerned to understand these two muscles simply as parts of the wall of the pelvic cavity. The obturator internus muscle is covered on the inside by this layer of pelvic fascia. There's an important line of thickening in the fascia called the tendinous arch. The tendinous arch goes from the body of the pubis to the ischial spine. We'll see why the tendinous arch is important in a moment. Now we'll move on to look at the muscles of the pelvic diaphragm. These muscles form a sling which closes off the inferior pelvic aperture and supports the organs that lie within the pelvic cavity. On each side, the pelvic diaphragm is formed by two most unequal muscles, the small coccygeus muscle behind and the much larger and more important levator ani muscle in front. Here's the coccygeus muscle. It runs from the ischial spine to the edge of the lower sacrum and coccyx. Coccygeus is a vestigial muscle with no demonstrable function. Now we'll add the levator ani muscle to the picture. Here's the levator ani. The levator ani has a line of origin that's partly bone and partly fascia. In front it arises from the body of the pubis. Behind it arises from the ischial spine. Between these two bony origins it arises from the tendinous arch in the fascia that overlies obturator internus. The fibers of levator ani pass downwards, backwards and medially to meet in the midline with those of the opposite side, as we'll see shortly. Let's go round to the back to see the underside of levator ani. Here's the ischial tuberosity, here's the sacrotuberous ligament. The space between these structures and the underside of the levator ani is called the ischiorectal fossa. In the living body, it's filled with fat. The levator ani is described as having a number of parts, which are named as though they were separate muscles. Unfortunately, the names of these parts are somewhat irrational. This part of levator ani is known as iliococcygeus. Iliococcygeus is very thin. This part is pubococcygeus. It's much more substantial. Pubococcygeus is subdivided further in ways that we won't go into. Now that we've looked at one levator ani muscle, let's look at the two of them together. We're looking from above. Here's the upper part of obturator internus. Here's the tendinous arch. The ischial spines are here. Here's the tip of the coccyx. Here are the coccygeus muscles. Here are the two levator ani muscles. Between them, in front, there's a gap, the urogenital hiatus, through which pass the rectum, the urethra, and, in the female, the vagina. The fibers of levator ani, which arise more posteriorly, unite in the midline with this fibrous band, the anococcygeal ligament. The fibers which arise more anteriorly form a loop which passes around the back of the urogenital hiatus. Some fibers along the edge of the hiatus attach to the sides of the rectum, the urethra, and, in the female, the vagina. We'll add the urethra and the rectum to the picture. Here's the lowest part of the rectum. Here's the urethra, with the lowest part of the prostate in front of it. We'll see these structures in Volume 5 of this atlas. The levator ani and coccygeus muscles are covered over by this dense layer of pelvic fascia, which completes the pelvic diaphragm on the inside. The pelvic diaphragm supports the pelvic organs and closes off the pelvic outlet while allowing passage for the rectum, vagina, and urethra. When we're upright, The levator ani muscles are in a constant state of tonic contraction, which becomes greater or less in response to changes in abdominal pressure. The main action of the levator ani muscles is to keep a set of downwardly mobile structures, the pelvic organs, constantly in one place. In addition, vigorous contraction of the levator ani muscles pulls the lower end of the rectum upwards and forwards. Now that we've seen the intact pelvic diaphragm from above, let's look at it from behind and from beneath. Here are the ischial tuberosities. Here's the tip of the coccyx. Here are the sacrotuberous ligaments. Here are the two levator ani muscles. This is the ischio-coccygeus part. This is pubococcygeus.
I'm stopping this frame just to emphasize on the pubococcygeus muscle. Okay, and because if you notice, there's a U formation. That's the sling formation of the pubococcygeus muscle. It's also sometimes referred to as the area where you will find the U-shaped puborectal sling. It's in your manual. May I ask Dr. Angeli Name to please read on the pubococcygeus to the class? Page 43 of your manual, exercise, I think exercise 4. And describe the pubococcygeus muscle. You can take a screenshot if you like of this frame. Yes, Dr. Name.
Doc, wait lang po.
Sige, okay. Extracting. Okay. Pubococcygeus muscle. I'll just start it off and then you will continue po, while you're looking. So the pubococcygeus muscle is described as a thickened and most important part of the pelvic diaphragm. The most important part. So you have right and left pubococcygeus muscles that unite and posteriorly form a puborectalis. Okay, so it surrounds the rectum. Now, Doctora, are you already on the page?
Yes po, Doc.
Can you continue?
Okay po. Basahin ko na po, Doc. The pubococcygeus is the thickened and most important part of the pelvic diaphragm. Fibers of the right and the left pubococcygeus unite posterior to the rectum, forming the puborectalis. This union of fibers create a U-shaped puborectal sling and is responsible for the curvature of the anorectal junction. During defecation, the puborectal sling relaxes, the anorectal junction is straightened, and the expulsion of fecal matter is facilitated.
Okay, thank you so much, Dr. Nami. So that's why it's very important, okay, for you to understand and appreciate the pubococcygeus muscle, specifically the formation of your puborectal sling. Okay, this is in relation to the defecation process. Okay, so shall we continue?
Here's the urogenital hiatus. Here's the anococcygeal ligament. The levator ani muscles are continuous on the underside with this cone-shaped sleeve of muscle, the external anal sphincter, which maintains closure of the anus. Here's the opening of the anus. The external anal sphincter is tethered to the anococcygeal ligament by its most posterior fibers. In front, here's the divided urethra. The muscle surrounding it is the bulbospongiosus. Till now, we've been looking at the pelvic diaphragm in a dissection of a male body. Here's a similar dissection of the pelvic diaphragm of a female body. The overall structure of the female pelvic diaphragm is the same as the male, except that the pelvic diaphragm is also traversed by the vagina. Here's the opening of the urethra. The whole region between the coccyx, the ischial tuberosities, and the pubic symphysis is called the perineum. The area between the ischiopubic rami is the urogenital triangle. We'll look at the important structures of the urogenital triangle in Volume 5 of this atlas. We've been looking from behind at an isolated dissection of the pelvic diaphragm with everything else removed. To get a more complete view of where we are, we'll now add the main surrounding structures to the picture. To see the pelvic diaphragm clearly, we've been looking at an unnaturally empty pair of ischiorectal fossae. In the living body, the ischiorectal fossa is filled with fat, which is traversed by nerves and vessels, as we'll see. Here are the sacrotuberous ligaments. Here are the ischial tuberosities. Here are piriformis and obturator internus, going to their insertions on the femur, along with the gemelli and quadratus femoris. Here's the sciatic nerve, emerging below piriformis.
Just to cite that the more common orientation where you will find the sciatic nerve emerging posteriorly is below the piriformis. However, there are normal variations na pwedeng mangyari kapag you encounter cadaver dissection. Biglang sa taas ng piriformis na nakita, lumabas. Or sometimes meron yung biglang, it can also pass through the piriformis. It happens, no? We encountered that, I think 2-3 years ago in one of the cadavers. Merong normal variant. But remember, anatomically speaking, no, the more common site would be the sciatic nerve emerging below or the undersurface of the piriformis muscle. Okay?
Here's gluteus medius. Here are the origins of the hamstring muscles. Here's the line of origin of gluteus maximus, which we'll add to the picture. The lower edge of gluteus maximus covers up the ischiorectal fossa when seen from behind. On the inside, the walls of the pelvic cavity are covered with a layer of loose connective tissue, which is lined in part by peritoneum. We'll see this in a minute when we move on to look at the blood vessels and nerves of the region. Before we do that, let's review what we've seen of the pelvic muscles.
So review time ulit. Folks, could you kindly open again your cameras, please? Kindly open your cameras as you will try to answer again and identify the structures. Okay. Sige. Tingnan natin sinong mauunang makasagot. Okay, what is this muscle?
Piriformis po.
Okay, very good. It passes through which foramen?
Greater sciatic foramen.
Very good. Okay. Next structure. Let's just listen to confirm.
Piriformis.
Very good. Next. What is this muscle?
Obturator internus po.
Okay, very good. Saan naman ito dumadaan?
Hello po, Doc, at the lesser sciatic foramen.
Okay.
Internus.
Oh, what is this? What did Dr. Aklan point to? He pointed it through a certain structure. Hindi yung puti na whole film that's overlying the
Tendinous
arch. Okay. Anong, very good, correct. Anong importance ng tendinous arch? Ano siya? Bakit kaya tendinous? Anong meron sa taas niya? Anong meron sa baba? Usually the start of your levator ani muscles, di ba? Diyan siya. Okay? Sige. So that is why there's a thickening, more opaque itong area na to. So if, for example, the slide that you will see during your practical exams are a series of arrows. So series of arrows, we are clearly demarcating the tendinous arch. Huh? But if you are being asked to identify this whole thing, this white, okay, transparent film covering the muscles beneath it, anong tawag niyo dyan? Meron dito. Okay. Okay, very good. So, hindi tayo malilito. Thank you. Next. Oh, what's this? Relate it muna sa attachment. Clearly, it's still part of the coccyx and lower portion of your sacrum. And try to imagine ito yung greater sciatic foramen nyo, andito sa baba yung mesocyatic foramen nyo. So it's attached to the ischial spine. What is this muscle?
Coccygeus.
Coccygeus, very good. And this one, it's a sagittal view. This is the symphysis pubis. The sacrum is there ending with the coccyx here, so there's no bone below this. What is this muscle? Collectively referred to as? Levator ani. What comprises your levator ani? What three muscles?
Iliococcygeus.
Pubococcygeus po.
Rectalis.
Okay, very good. What is the missing link para maging pelvic diaphragm na siya? What's the missing link? Levator ani plus blank equals pelvic diaphragm.
Coccygeus po.
Okay, coccygeus. Okay. So, hindi tayo magkakalituhan. Yan, medyo makulit ako eh. Pasensya na. Okay. Next. Meron pa ba? Parang wala na. Uy! Okay, medyo pahirapan yata ito. Ewan ko kung andun ba si Dr. Bea? Tatanungin kayo ni Dr. Bea ito. Okay, so let's listen to Aklan. Okay? It would be better to see it in terms of a diagram. Refer to network. So this is... Okay.
This part is pubococcygeus.
Okay, so if that is the pubococcygeus, the structure
This
above
part is iliococcygeus.
iliococcygeus. The one
This
below
part
is
is
the
pubococcygeus.
Okay? Sige. So we can now move on to the next. I hope you got the... Mukhang papasa to Pahirapan na yata natin ng practical sa section na to. Ito yata yung paisa-isa tayo ng iba-iba ang magiging practicals nyo. At saka written exam, unit test for this topic. Okay, let's move on to the neurovascular structures. You can open your manual. You can refer to the manual kasi this is a bit difficult to appreciate, okay, and memorize agad-agad. Okay?
That brings us to the end of this section on the pelvis, and also to the end of Volume 3 of the Video Atlas of Human Anatomy. Move on to look at the blood vessels and then the nerves of the pelvis and perineum. First, the blood vessels. Here's the pelvic cavity, seen from above, with the abdominal and pelvic organs removed and the soft tissue lining of the cavity intact. The pelvic cavity is lined, somewhat irregularly, with peritoneum. Beneath that, there's a layer of pelvic fascia that's continuous with the endo-abdominal fascia. The internal iliac artery, which we saw in the last section, is hidden just under here. To see the pelvic blood vessels, we'll remove one half of the pelvis and go round to a medial view. We'll also remove the lining of peritoneum and pelvic fascia. In this dissection, the veins, which follow the arteries closely, have been removed to simplify the picture. The arteries of the pelvic region are all branches of the internal iliac artery.
Wait a minute. Take a screenshot of this frame. Take a screenshot of the frame, save it on your laptops or your units, and then identify all the necessary, all the blood vessels that you can see in this image. Okay?
The way they arise is quite variable. This is the superior gluteal artery. This is the inferior gluteal. They pass through the greater sciatic foramen to supply the buttock region. This is the internal pudendal artery, which we'll return to in a minute. This is the obturator artery, passing forwards into the obturator canal, along with the obturator nerve. The most anterior branch of the internal iliac comes to a blind end. In the fetus, it's the umbilical artery. Branches to the pelvic organs arise in a widely varying fashion. These are the divided ends of the vesical arteries, superior and inferior, which supply the bladder. This is the middle rectal artery, which supplies the lower part of the rectum. In the female, the uterine arteries also arise, directly or indirectly, from the internal iliac. The branch of the internal iliac that concerns us most closely here is the internal pudendal artery. It supplies the blood supply to the perineum. To reach the perineum, the internal pudendal artery goes out through the greater sciatic foramen, around the sacrospinous ligament, and back in through the lesser sciatic foramen.
Okay, again, what is the structure that passes through the greater sciatic foramen, moves a little bit to the back, and then re-enters to the lesser sciatic foramen? What is this?
Internal pudendal artery po.
Okay, remember that, memorize.
In this way, the internal pudendal artery ends up below the pelvic diaphragm. To follow its course, we'll go round to the back. The gluteal vessels and the sciatic nerve have been removed. Here's the internal pudendal artery, emerging below piriformis. It passes behind the sacrospinous ligament, which is here, and behind this small muscle, the superior gemellus. The internal pudendal artery runs downwards and forwards along the medial aspect of obturator internus. Its branches supply the anal sphincter, the pelvic diaphragm, the external genital structures in the female, and the penis in the male. Now that we've looked at the blood vessels, we'll look at the principal nerves of the pelvic region. We'll look at the sacral plexus, then at the pudendal nerve, then at the autonomic nerves of the region. Here's the sacral plexus. Its lower part lies on the front of the piriformis muscle. The sacral plexus is formed mainly by the anterior primary rami of the spinal nerves S1 through S4.
Okay, again, take a screenshot of this frame. This time, focus on identifying the nerve structures. Okay? Focus on identifying the nerve structures.
In addition, the plexus receives a contribution from L4 and 5 through this big nerve bundle, the lumbosacral trunk. The major branches of the sacral plexus leave the pelvis by passing through the greater sciatic foramen, either above piriformis or below it. Almost all the nerves that arise from the sacral plexus go to the lower extremity. They're shown in volume 2 of this atlas. The branches of the sacral plexus that do concern us here are the pudendal nerve, which is the principal nerve of the perineum, and also the small motor nerves to the pelvic diaphragm. A small branch or branches from S3 or 4 supply most of the levator ani muscle and the coccygeus muscle on their pelvic surfaces. Here's the pudendal nerve. It's derived from S2, 3, and 4. It arises from the plexus just above the sacrospinous ligament, which is here, and passes immediately through the greater sciatic foramen. To see where it goes, we'll go round to the back. Here's the pudendal nerve again. Here, next to it, is the internal pudendal artery, which we've already met. We'll go to an underneath view to follow the pudendal nerve. It passes forwards on the side of obturator internus along with the internal pudendal artery. Its branches supply the anal sphincter, the muscles of the urogenital diaphragm, and the external genitals.
Okay, what was that nerve that was just discussed? The
Pudendal
nerve. So dumadaan din siya ng greater sciatic foramen, bumababa, pumupunta siya sa likod, tapos dadaan ulit sa lesser sciatic foramen. Ano yung accompanying structure sa pudendal nerve, which has the same, if you trace it, pareho sila ng route. What is that other structure that accompanies the pudendal nerve?
Internal pudendal artery po, Doc.
Okay, very good. Yan. Okay, so dalawa sila magkapart. Okay? Sige. So they both pass through the greater and the lesser sciatic foramen. Very good. Yeah. Kasi na natin ito.
Lastly, we'll look at the autonomic nerves of the pelvic region. The autonomic nerves in the pelvis that belong to the sympathetic nervous system are the tail end of the sympathetic trunk and the so-called hypogastric nerve. The parasympathetic nerves in the pelvis are the pelvic splanchnic nerves. All these nerves, sympathetic and parasympathetic, are connected to a diffuse and extensive plexus of autonomic nerves called the pelvic plexus. The pelvic plexus lies within the fascia that covers this part of the pelvic wall and floor. A small part of the pelvic plexus has been partially dissected out here. The pelvic plexus distributes the sympathetic and parasympathetic supply to the distal colon, the pelvic organs, and the external genital organs. Feeding into the pelvic plexus from above is the hypogastric nerve, single here, but often taking the form of several small nerves. It's the distal continuation of the aortic plexus. Here's the distal end of the sympathetic trunk. It enters the pelvis deep to the common iliac vessels and descends just medial to the sacral foramina. It gives rami communicantes to the anterior rami of the sacral nerves. Lastly, here are the pelvic splanchnic nerves, sometimes called the nervi erigentes. These are the source of all parasympathetic innervation in this region. They arise in this case from S3, also often from S2 and S4. They break up into branches which enter the pelvic plexus. From the plexus, their fibers are distributed to the pelvic organs and external genitals. Now, let's review what we've seen of the blood vessels and nerves of the pelvic region.
Sige, let's just try to name the blood vessels. Pwede kayong tumingin sa mga manuals nyo para matulungan kayo. Okay? We will just go through the exercise. Let's name the first blood vessel or the first structure that will be pointed. What is this?
Internal iliac artery.
Iliac artery.
Correct. Next. What is this structure?
Superior gluteal artery po yung nasa taas, then inferior gluteal po yung naka-pointed po ngayon.
Okay, very good. Ay, biglang umandad. Sorry. Very good. Okay. Yan.
The superior gluteal and inferior gluteal arteries.
Okay. Next. Ano ito?
Gerator artery.
Artery.
Oh, greater
Ends of
artery.
the sacral vessels.
Okay.
The middle rectal artery.
Middle rectal.
The start of the pudendal artery.
Start of the pudendal. Let's go back to that frame. Start of your it's a branch. Pudendal artery. Okay.
Pudendal artery. And its further course.
Okay. So, ibig sabihin, pwedeng magpakita tayo ng nasa likod, pwedeng nasa harap. Dapat master niyo. Next.
Now the nerves. Here's the sacral plexus.
Sacral plexus.
And the lumbosacral trunk. Here's the pudendal nerve from the inside.
And then again
And
at
from
the back.
behind. Here's the area of the pelvic plexus.
Okay, the pelvic plexus is responsible for what functions? Simpa and parasimpa. Okay?
Here's the hypogastric nerve.
Which is a branch of coming from the aortic plexus. Okay?
The sympathetic trunk.
Okay.
And the pelvic splanchnic nerves.
Okay, tapos na tayo dito. So, I hope you were able to at least absorb the major structures that you need to know about the pelvis, the neurovascular structures, and the pelvic floor at the same time. Now, we will move on to the last video, which is the common pelvic organs found in males and females, which are again the rectum, the sigmoid colon, the bladder. Okay? So last leg na to, I think it's about 11 minutes, and then you can proceed to, to the breakout group. Before I forget, I'm sending sa inyong chat box 2 links to a video. Okay? You can watch it at your own pace and time. Tapos, it will help you identify also the structures using a dryer specimen. Marami siyang captions that will also help you identify the structures. They are also must-knows. So do it in your own time. You can review it anytime, kahit sa weekend. Okay? So let's now finish the last leg of your videos.
That brings us to the end of this section on the pelvis, and also to the end of Volume 3 of the Video Atlas of Human Anatomy. The sigmoid colon forms a large, freely mobile loop that's attached by this double sheet of peritoneum, the sigmoid mesocolon. The sigmoid colon passes down into the pelvic cavity. There's a lot of it down there, which we'll bring out. As it passes into the pelvic cavity, the sigmoid colon approaches the midline. The sigmoid mesocolon becomes shorter as it enters the pelvis and ends altogether down here. The sigmoid colon ends at the level of S3, where it merges with the rectum. Now we'll look at the rectum, where fecal material is stored before being eliminated. Looking down into the pelvis from above, we can only see the most proximal part of the rectum. Here it is. To see all of the rectum, we'll look at 2 different specimens, one divided along this line, one along this line, going all the way down through the pelvis and perineum. Before we look at the rectum, we need to get our bearings. On each side, the cut went through the iliac crest, the blade of the ilium, the acetabulum, and the ischiopubic ramus. Here's the same cut made on a dry bone specimen. Here's the pelvic brim, and here's the pelvic brim in the dissection. Here's the cut edge of the peritoneum that lines the small upper part of the pelvic cavity. Here's the lower end of the sigmoid colon. Here's the rectum. From here, the peritoneum that covers the upper part of the rectum sweeps forwards, leaving most of the rectum with no peritoneal covering. We'll come back to this view in a minute. To see what's behind the rectum and in front of it, we'll look at a different specimen that's been divided just to the left of the midline, leaving the rectum intact. Here's the promontory of the sacrum. Here's the divided body of the pubis. Here's the rectum. Here's the lower limit of its peritoneal covering. The rectum lies in front of the lower half of the sacrum and the coccyx. It conforms to their overall curve. Here in its lower part, the rectum runs downward and forward on this sling of muscle, the levator ani. The levator ani is the principal structure of an important partition, the pelvic diaphragm. The rectum turns sharply backwards as it passes through the pelvic diaphragm, becoming continuous with the anal canal. In front of the rectum are the bladder, the seminal vesicles, and the prostate in the male, and the uterus and vagina in the female. To see some more details, we'll go to the front view again. As the sigmoid colon merges into the rectum, the tenii broaden out, so that the rectum has a coat of longitudinal muscle that's almost continuous. The lower part of the rectum, known as the ampulla, is quite distensible. This space around the rectum isn't empty. In life, it's occupied by fatty connective tissue that accommodates to changes in the size and shape of the rectum. Here's the pelvic diaphragm sloping down on each side. It's formed mainly by the levator ani muscle. This is the puborectalis part of the levator. As the rectum passes through the pelvic diaphragm, it becomes continuous with the anal canal, which ends here at the anus. The lower end of the rectum runs downwards and forwards. The anal canal runs downwards and backwards. The angulation between the rectum and anal canal, the perineal flexure, is maintained by the forward pull of the puborectalis part of the levator ani muscle. Closure of the anal canal is maintained by the internal and external anal sphincter muscles. The involuntary internal sphincter is a continuation of the circular smooth muscle coat of the intestine. It's present in the proximal 2/3 of the anal canal. The voluntary external sphincter runs the full length of the canal. This is the external anal sphincter. It's somewhat funnel-shaped. Above, the external sphincter merges with the levator ani muscle. Its upper part consists largely of annular fibers that go all the way round. Its lower part is formed mainly of fibers that pass from back to front. Behind these, fibers are attached to the anococcygeal ligament. In front, they're attached to the perineal body, or central perineal tendon, which is here. The levator ani muscle is shown in more detail in tape 3 of this atlas. Now we'll take a further look at the bladder, first in the male, then in the female. Here's the bladder. Here below it is the prostate. In this dissection, the bladder has been filled slightly, which brings it just above the level of the pubic symphysis. When the bladder is full, it rises up into the lower abdomen. When it's empty, it flattens out. The bladder has a covering of peritoneum only on its upper surface. Down here, the bladder tapers towards its outlet or neck. Here behind the bladder is the rectum. In this dissection, the fatty connective tissue that lies between the bladder and the rectum has been removed. To see the structures that are just behind the bladder, we'll take the rectum out of the picture. We've also cut the ureter short. The ureter, here's its cut end, enters the bladder out to the side, passing through the bladder wall obliquely. The ductus deferens comes around almost to the midline, widening to form the ampulla. Here lateral to the ampulla is the seminal vesicle. Here's the right ampulla and the right seminal vesicle. On each side, the ductus and the seminal vesicle join down here to form the ejaculatory duct, which passes through the prostate to enter the urethra, as we'll see when we look at the reproductive system. To see the inside of the bladder, we'll look at an isolated specimen that's been divided along this line. The wall of the bladder consists of smooth muscle lined with mucosa. On each side, the ureter opens into the bladder obliquely at the ureteric ostium. Urine leaves the bladder through this opening, the internal urethral meatus, to enter the urethra. This projection just above the urethral meatus is called the uvula. The mucosal lining of the bladder is thrown into irregular folds which flatten out as the bladder fills. The mucosal layer is relatively flat in this triangular area between the ureteric and urethral openings, which is called the trigone. In the male, the first part of the urethra passes downwards through the prostate. The prostate, or prostate gland, consists of smooth muscle interlaced with glandular tissue which secretes a portion of the seminal fluid. Down here at the apex of the prostate, the urethra emerges. The proximal part of the urethra, the membranous urethra, passes downward through the sling of muscle that forms the pelvic diaphragm. This part of the muscle sling is the levator prostatae. It's the most anterior and medial part of the pubococcygeus, which, in turn, is part of the levator ani muscle complex. Just below the pelvic diaphragm, the urethra passes through the perineal membrane, which has been removed in this dissection. The membranous urethra, which is here, is surrounded by the voluntary external urethral sphincter muscle, which is continuous with the levator prostatae. Immediately beneath the pelvic floor, the urethra enters the bulb of the penis. We'll follow its further course later in this tape. Now we'll look at the same area in the female. Let's get oriented again. Here's the pubic symphysis. Here's the coccyx. Here's the cut edge of the pelvic diaphragm. It's being supported artificially on a wire frame. Here's the vaginal opening. Here's the anus and the external anal sphincter. Here's the bladder, with the ureter entering here. Immediately behind the bladder is the vagina, and above it, the uterus, very small in this specimen. We've removed the broad ligament, which was here. Directly behind the vagina is the rectum. The female urethra is quite short. This is the urethra, surrounded by the external urethral sphincter muscle. The female urethra ends by entering the vestibule of the vagina. We can see the urethra better in this isolated specimen. Here's the bladder, here's the vagina. Here's the entrance to the vagina, the vestibule. The urethra starts here and runs parallel to the vagina. It's surrounded by the external urethral sphincter muscle. The vagina and urethra pass through the pelvic diaphragm. We've left a fringe of the pelvic diaphragm intact here. It's attached both to the urethra and the vagina. To see the urethra, we'll look at a specimen that's been divided in the midline. Here's the lower part of the vagina. Here's the vaginal vestibule. Here's the urethra. Here's the external urethral sphincter muscle. Here's the internal urethral meatus. Here's the external meatus. Here's the external urethral meatus, seen from below, opening into the vestibule of the vagina. We'll see more of the male and female urethra in the following section on the reproductive system.
Ayan. Natapos na ang ating video lab series for the morning. Thank you for watching ang ating saga on the pelvis. Okay. So for now, can we ask everybody again to just turn on your cameras? Okay. Nabilin na lang before we break you out and then allow you to leave or have your early lunch. Okay. Stop sharing. Here you go. Okay, so it's already 11 past 11.